All right, thanks. Well, all eyes are on Washington, D.C. this week as the Supreme Court justices are expected to make a ruling on health care.
Could be today or tomorrow. In the meantime, the health care law stands, and one government agency is on a mission to let baby boomers who are aging quickly know about fairly recent changes that will affect their health, namely preventative screenings offered to those on Medicare at no cost. More on that in today's What's Your Problem?
A very easy way to stay healthy is to take advantage of preventive services and health screenings.
Nancy Bolton O'Connor is the regional administrator for the Centers for Medicare and Medicaid Services, and on a recent trip to Hampton Roads stopped by to talk about a way to get Americans feeling better.
The Affordable Care Act actually really opened the door to people's ability to take advantage of those services, because for many, if not most of the services, there's virtually no co-payment or deductible associated with them. So they're pretty much free for Medicare beneficiaries.
At the Medicare.gov website, information on preventative tests takes up several screens, from mammograms, pap smears, colonoscopies, prostate screenings, plus new ones that seniors may not realize are covered. For example, an alcohol misuse screening. If you screen positive, you can get up to 4 counseling sessions a year. Diabetes screening, a test for depression.
Believe it or not, 1 in 6 seniors are depressed. And the number even goes higher if you have some type of chronic disease or cancer, or you've lost family members or friends.
Medicare recipients are eligible for up to 8 counseling sessions a year to try to stop smoking. If your BMI is 30 or greater, you may be eligible for face-to-face counseling and a dietary assessment. And seniors can be screened for sexually transmitted diseases.
We are seeing an increase in the Medicare population, 65 and older, with sexually transmitted diseases.
Preventive medicine is also covered: the flu shot, the pneumonia vaccine, and the Affordable Care Act of 2010 did away with copays or deductibles for them, as well as for preventive tests.
Medicare beneficiaries, when you talk to them, they're not aware of all the preventive services that they can take advantage of.
If you are 65 and older and you've worked at some point in your life, O'Connor says, then likely you are entitled to Medicare, or if you are disabled or suffering from end-stage renal disease. And the testing starts in the first year on the program with a Welcome to Medicare physical, where you see a doctor in order to set up a plan, a short-term one and a long-term one, to map out screening and health care in the future. Every year after that, the checkups are also part of the program.
If the doctor decides you need some other test beyond the screening service, for instance, if you need an EKG or if you need some other follow-up service, there could be a copay, or you would have to pay your deductible with that additional service. And some people don't realize that.
You may have questions. If so, you can call 1-800-MEDICARE or go online to Medicare.gov. We put that information at thehamptonroadshow.com.